Okay, so you're here because you want to get informed, fast, and deep. Let's get straight to it.
That's good.
We're diving into something really interesting today. The way our understanding of autism is changing, specifically how it shows up in women.
Right. And you flagged a great source for this autism in women from neurologic clinics. Pretty recent, from last year.
Exactly. And what really jumps out is how it maps this shift, doesn't it? Away from seeing autism as mostly a male thing.
Yeah, for so long, the picture we had, the way we looked for it was, well, it was based heavily on how boys and men present.
Which means we were missing a huge part of the story, right? So our mission here really is to pull out the key ideas from this article. How does autism look different in women sometimes?
And why? What's behind those differences?
Yeah, and crucially, what does all this mean for, getting diagnosed and getting the right kind of support?
And that starting point, that male-focused view, it really shaped everything. The early research, the diagnostic tools we used. The article points out a really striking change in the numbers, actually. Older studies, kind of passive ones, suggested maybe 4 or 5 boys diagnosed for every girl.
Okay.
But newer research, studies that are actively looking for cases, they're finding a ratio that's more like 2.5 or 3 boys to 1 girl.
Wow. Okay, so let's unpack that. That's almost cutting the ratio in half.
Pretty much.
That's not just a number. That suggests potentially a lot of women haven't been recognized.
Exactly. It's strong evidence that autism in women has been significantly under-recognized.
Meaning women living with challenges, maybe not understanding why, not getting the right support.
Precisely. Going through life potentially without that framework, that diagnosis, to understand their experiences.
So this leads us right into how the symptoms might look different. The article says women might not fit the prototypical male profile. What does that actually mean in practice?
Well, it highlights that women often have this unique profile, and it's frequently more subtle.
Subtle how?
Think about the core things. Social communication difficulties, restricted or repetitive behaviors and interests, the ROBIs.
Like intense interests or needing routines.
Right. Those are still there, but how they show up might be different. Maybe the interests are less obviously unusual, or the social difficulties are masked more effectively.
So it's definitely not a simple checklist where everyone looks the same. It makes me think of that quote, Dr. Stephen Shore's quote.
If you've met one person with autism, you've met one person with autism. Yeah, the article brings that up too.
It really drives home how diverse the experience is.
Absolutely. And when we talk about these sex differences, we're talking averages, general trends. It's crucial to remember that.
Yeah, not hard rules. You'll have women who present more typically, men who are more subtle.
Exactly. It's a spectrum within a spectrum, really.
Okay, so beyond just seeing these differences, the article digs into the why. What could be causing these different presentations? Let's start with the biology.
Okay, so biologically, the article talks about a really complex mix of things. There are genetic variations, factors in the prenatal environment, and also epigenetic effects. That's basically how the environment can switch genes on or off. All these could play a role in why males and females might have different sort of liability or predisposition to autism.
That sounds incredibly complex, not just one simple biological switch.
Definitely not.
Okay, what about the social side? Culture, environment. This feels really important for how behavior gets interpreted.
Hugely important. The article points out that kids without major developmental delays, and this includes many autistic girls, are basically raised with the same social rules and expectations as their non-autistic peers.
Right, and those expectations can be really different depending on gender, can't they?
For sure. The article mentions how kids often separate themselves by gender in playgroups in school.
Yeah, self-segregation.
Which creates kind of different social worlds, different norms for interaction within those boy groups and girl groups. And on top of that, parents or caregivers might just have different expectations for a boy's development versus a girl's.
So maybe more pressure on girls to conform socially, to learn the rules, fit in.
That's a strong possibility. And that pressure might lead them to hide or suppress some of the underlying autistic traits.
Which brings us neatly to camouflaging. The article really stresses this.
It's a big one. Women with autism might use strategies, consciously or not, to mask their social communication differences.
Mask them how? Like what kind of strategies?
Things like deliberately copying facial expressions they see others use. Or maybe learning social scripts, like lines to say in certain situations to start or keep a conversation going.
So it's an active effort to navigate social stuff.
Exactly. It's effortful. And while it can help them get by, it also makes it way harder for doctors or psychologists doing an evaluation to spot the underlying autism.
Because what they're seeing isn't the whole picture.
Right. The article specifically says it's important to ask women directly if they use these kinds of strategies. Like, do you consciously try to copy others in social situations?
That seems vital for an accurate assessment. If someone's putting on a performance, essentially during the evaluation, you might miss what's really going on, which leads to the diagnostic process itself. The article suggests our tools might not be catching the female presentation effectively.
That's a key point.
Yeah.
There's this concern that some assessment tools, developed mostly with boys and men in mind,
Right.
might just not be sensitive enough. They might not pick up on the more subtle ways autism can manifest in girls and women.
Meaning women might need to have more obvious or more stereotypically male traits to actually meet the criteria, like
Yeah.
a higher bar.
Potentially, yes. A higher threshold to cross for a diagnosis?
That feels unfair, and it could explain some of the underdiagnosis. Didn't the article mention a model predicting how many women should be diagnosed?
It did. A predictive model estimated that, I think it was around 39% more women ought to be diagnosed with ASD than currently are.
39%. That's huge.
It's a really significant gap.
And it's not just the tools, right?
Yeah.
The article also talked about bias, like how we think about autism.
Yes, exactly. The public understanding, and maybe even among some healthcare professionals, is still quite shaped by that older male-centric view.
So if you have that image in your head,
Mm-hmm.
you might be less likely to spot the signs in a girl or woman. Parents might not recognize it. Teachers might not. Even the woman herself might not connect her experiences to autism. So they're less likely to even seek an evaluation.
So it's this kind of combination, tools that might not be sensitive enough, plus a societal lens that's maybe looking for the wrong picture.
Pretty much.
This all just underscores why getting a diagnosis and getting it in a timely way is so critical, especially for women. Why does the article say it's so important?
Well, timely diagnosis leads to better outcomes. It reduces the burden, the struggle.
And crucially, earlier diagnosis means earlier support can begin. The article cites research showing interventions have the biggest positive impact on social communication skills when started young, like between 3 and 4 years old for kids.
Okay, so that specific age is for kids, but the principle holds, right? Understanding yourself, getting support earlier rather than later.
Absolutely. That self-understanding and access to the right support can make a massive difference at any stage of life.
Definitely. Now, what about co-occurring conditions? Does the article say anything specific about women here?
It mentions briefly that women on the spectrum often seem to have a greater number of co-occurring conditions.
Like anxiety or depression, maybe?
It doesn't list specifics for women in that section, but it notes more generally that ASD often comes with other medical or mental health conditions at higher rates than you see in the general population.
Okay.
And it points to genetics and environment playing a role in that broader picture. So that general tendency might just manifest as a wider range of conditions in women too.
Adds another layer of complexity. Okay, so finally, support. Things like ABA, CBT are mentioned generally. Anything specific for supporting women given these different presentations?
Well, the core ideas behind therapies like ABA, applied behavior analysis, or CBT, cognitive behavioral therapy, can still be useful, of course.
Yeah.
But the article really emphasizes that treatments need to be tailored. You have to look at the individual woman's specific needs, how her autism presents.
Right.
So considering her social communication style, the impact of all that camouflaging we talked about, any co-occurring issues, the support needs to be adapted to fit her experience.
Makes perfect sense. So wrapping this up, it feels like our whole understanding of autism in women is really shifting, evolving.
Definitely.
We're learning it can look quite different from that old male-based template. And that has huge implications for actually identifying and supporting people properly.
Exactly. Recognizing the nuances, understanding the biology and the social pressures, being aware of camouflaging, these are all vital.
Yeah, vital for getting women a fair shot at diagnosis and the right kind of help.
Couldn't agree more.
This has been really illuminating. It really makes you think, doesn't it? Considering these subtleties, the history, how does our whole society's view of neurodiversity need to change? How do we get better at recognizing and supporting everyone on the spectrum, whatever their gender?
That's the big question, isn't it?
Yeah.
Something for all of us, and you listening, to keep thinking about as we learn more.